be honest, after OpenNotes started, I haven't monitored any of my notes. If it's a sensitive issue, I tend to discuss it with the patient during the visit, and I haven't blocked out certain parts of a patient's chart, so that they are not able to view it.
It shouldn't be different from the conversation that we have in the office. And if that conversation was difficult, which sometimes it is, then the note will reflect some of that difficulty.
I think that a lot of the psychological stuff that is subtext during a visit, which we don't necessarily say out loud, we probably should be saying out loud. I'm worried that you look depressed. I'm worried that you are anxious about what I'm telling you, and it's going to upset you. You know, rather than thinking, maybe this will upset this person if I tell them that, so I won't tell them. I think the more we bring it out, the better we do. So if OpenNotes helps do that, that's probably a plus.
I think that it tests our paternalism in a way. It, in some ways, I think that's mostly good. I think that we do have a tendency to try and protect patients from possible risks or scary diagnoses until we feel obliged to tell them that they have that. I think that this forces us to perhaps not protect them as much, to trust them that they can live with that risk if we contextualize it enough earlier in the process than I might have otherwise.
We still can have records, certain patients' records be monitored, and those notes would still be outside of viewing for patients.
That would probably be appropriate in some mental health issues. It might be appropriate in some cases where there's a behavioral issue.
If you thought that day-to-day viewing of their records would be possibly harmful to their health, I could see how that might be true for some psychiatric patients. So we'll have to see, right? Because it's a change.